An important thing to realize early on about antisocial personality disorder, or ASPD, is that it has definitely been around since the beginning of human interaction. There were probably cave people who were nonconformist, irresponsible, indifferent, reckless, irritable, and/or passive-aggressive. That being said, we're going to speed ahead to the early 1800s and the studies of Philippe Pinel. Pinel conducted several studies and noticed that some of his patients did morally wrong and deceitful acts with full comprehension that they were morally objectionable. He called their damaged moral compass la folie raisonnable, or moral insanity. Many psychologists tried to reason this moral insanity with appearance, stating that people could only psychologically connect with friends based on similar forehead slopes. Some even described a correlation between profile slant, the shape of the face from the side view, and intelligence. People use psychopathy and sociopathy to label individuals with ASPD until 1980, when ASPD first appeared in the DSM-3. Psychopathy, sociopathy, and antisocial personality disorder are very similar branches of the same tree of personality disorders and remain connected on a spectrum of issues with interpersonal and intrapersonal actions. The DSM-4 mainly showed ASPD as it related to other people rather than the patient themselves. To be diagnosed with ASPD via DSM-4, a person had to have hurt, mistreated, or stolen from someone. They also had to have several of the following criteria: failure to conform to legal behaviors, deceitfulness, impulsivity, irritability, aggressiveness, irresponsibility, and/or lack of remorse. Finally, they had to be an adult, show evidence of misconduct before age 15, and not be in the middle of a schizophrenic or manic episode. The DSM-4 criteria for diagnosing ASPD was very focused on how the patient affected society instead of how the patient affected their own lives. The unveiling of DSM-5 provided much more detailed explanations of personality traits and functioning. I'm going to use a television character who has had a profound influence on my life to illustrate some of these criteria. Dr. Gregory House from House MD. Alright, so here are some of the different personality traits and actions. 1. Impairments in self-functioning. A. Identity. Egocentrism. Self-esteem derived from personal gain, power, or pleasure. House is a diagnostic physician or a doctor who takes care of cases that other doctors can't diagnose and runs through a trial and error process until they figure out what the patient has. Here's an explanation of it during a speed date.
I'm a diagnostician. I find out what's wrong with people and I fix it.
Don't all doctors do that?
Yeah, but they can't dance like I can.
So when House finally cracks a case, usually at the end of an episode after many near-death emergencies, he does not express any sort of joy from his success. He only waits until he gets a new puzzle to solve. Self-direction, goal setting based on personal gratification, absence of pro-social internal standards associated with failure to conform to lawful or culturally normative ethical behavior. House doesn't really play by the rules of being a doctor sometimes and often has had his medical license threatened or revoked due to reckless and disrespectful mannerisms. He rarely expresses fear at the thought that he would no longer be a doctor. Listen to his interaction with his superior at the hospital.
Is it still illegal to perform an autopsy on a living person?
Are you high?
If it's Tuesday, I'm wasted.
There are also impairments in interpersonal functioning, empathy, lack of concern for feelings, needs, or suffering of others, lack of remorse after hurting or mistreating another, intimacy, incapacity for mutually intimate relationships as exploitation is a primary means of relating to others, including by deceit and coercion, use of dominance or intimidation to control others. House attempts many romantic relationships, but fails to make them last due to his inability to compromise his own needs. He often takes Vicodin to feign emotions. People with ASPD also exhibit antagonism, which is characterized by manipulativeness, frequent use of subterfuge to influence or control others, use of seduction, charm, glibness, or ingratiation to achieve one's ends, deceitfulness, dishonesty and fraudulence, misrepresentation of self, embellishment or fabrication when relating events, callousness, lack of concern for feelings or problems of others, lack of guilt or remorse about the negative or harmful effects of one's actions on others, aggression, sadism even. Hostility, persistent or frequent angry feelings, anger or irritability in response to minor slights and insults, mean, nasty, or vengeful behavior. House is often angry and excessively harsh to patients and fellow staff members. He also exploits his job to have time to hide out in exam rooms to watch General Hospital or play on his Game Boy. Disinhibition, characterized by irresponsibility, disregard for financial and other obligations or commitments, lack of respect for agreements and promises. Impulsivity, acting on the spur of the moment in response to immediate stimuli, acting on a momentary basis without a plan or consideration of outcomes, difficulty establishing and following plans. Risk-taking, engagement in dangerous, risky, and potentially self-damaging activities, unnecessarily and without regard for consequences. Boredom, proneness, and thought initiation of activities to counter boredom, lack of concern for one's limitations, and denial of the reality of personal danger. House engages in risky behaviors very often. He actually ends up driving a car through his ex-girlfriend's Thanksgiving dinner out of mixed boredom and rage when they break up. He also leads on his best friend with suicidal hints in an episode to actually takes him to an hotel where he acts as if he's going to jump off the hotel to kill himself, and then cannonball dives into the pool below. This is after he dives.
What the hell are you doing? What do you do when you win? What do you do when you lose?
So just to give you some relief, House does actually find treatment for his ASPD. He had been self-medicating with huge quantities of Vicodin, but eventually weans himself off of it. He comes to the realization that what he's doing isn't really okay. This is his interaction with his psychiatrist.
I was deluded into thinking I might be crazy.
But you had been abusing Vicodin for years. Never had delusions, never had trouble sleeping, never had any problems other than narcissism and antisocial behavior until 2 colleagues died. Your father died. Your issues run deeper than Vicodin.
I like being alone. At least I convinced myself that I'm better off that way.
So he actually ends up overcoming his pride and reckless behavior to fake his own death, spoilers, so he can help his friend with terminal cancer through the last months of his life. So coming off of the House example, the lives of real people with ASPD unfortunately are not easily fixed with the spectacular series finale. People afflicted with the disorder generally do not seek help and sometimes do not even realize that their behavior is problematic. Talk therapy is sometimes helpful as it helps people to realize ways to remedy their injurious behaviors. No medication is currently approved for ASPD, but medications can be prescribed to treat symptoms like depression or aggression. Consultations with mental health professionals generally help individuals with ASPD to regulate positive behavior and phase negative behavior out of their lives. Regarding the social implications, ASPD is strongly associated with people who commit crime. Many murderers, such as Charles Manson, Jeffrey Dahmer, the Milwaukee Cannibal, and Tommy Lascelles, the coast-to-coast killer, are cited to show several symptoms of ASPD. There aren't really many examples of non-murdering well-known people with ASPD, so the lack of remorse associated with ASPD is strongly tied to serial killing. I used House as an example of a person who has the disorder without taking it to extremely illegal lengths, but society often writes off killers as crazy people with no hope left in their lives, but ASPD sheds light on how psychological trauma and genetic dispositions can lead to tragedy if left unchecked.